DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Good morning, folks, and welcome to DocTalk. Dr. Dan Thompson. Sure glad that you joined us today. It's going to be a great show. We're going to discuss how steroid implants work in beef cattle. My guest, Dr. Chris Reinhardt from the Animal Science Department from right here at Kansas State University. Enjoy the show.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Hey folks, welcome to Doc Talk. I'm Dr. Dan Thompson, and this is Dr. Chris Reinhardt, who is a friend and a colleague here at Kansas State University. He is an associate professor, fixing to be a full professor at Kansas State University in the Department of Animal Science and Industries. He is also our state beef extension specialist for feedlots, and he's a ruminant nutritionist. And Chris, first of all, I just appreciate all you do for Kansas, appreciate what you do for K-State and what you do for the Beef Cattle Institute. Let's get into this and start talking about breaking it down. Steroid implants have been around since the 50s.
Yes.
And, you know, what compounds are used?
Well, we can get super technical and put everybody to sleep, myself included, but in a broad sense, we typically use estrogenic and androgenic hormones, the common, what we'd all know as the female hormone and the male hormone.
So estrogenic would be like your estradiol or estrogens, androgenic or the testosterone, but we don't actually use testosterone, we use an analog called trenbolone acetate.
Correct. It's more potent than the testosterone, but it does essentially the same thing in the body.
With no sexual side effects.
Correct.
Okay, so when we use these compounds, you know, I think one of the things that amazes me is how small the dosage rate is. You know, I mean, just what kind of dosage rates are we talking about? These are 4, 5, 800-pound animals. We're a 200-pound beast.
And the total dosage we put in that animal's ear is in the milligram dosage, between 20 and up to 200 milligrams.
So when we're talking about 20 to 200 milligrams, how long, I mean, for like I said, if I'm going to take a 200 milligram Advil, I take 2 of those. So we're talking about 1 Advil equivalent dosage. Over how long a period of time is that? Is it daily, weekly?
No.
You know, I'm baiting you on that.
Yeah, we'll put that in, and we'll let that implant go for 100, 120, 150 days.
So we're talking about dosing an animal with 200 milligrams over 150 to 180 days in an animal that weighs 800 pounds. Not a very big dose.
Very, very small.
Now, these dosage rates, these are not oral, these are not injectable, these are a subcutaneous pellet that's placed underneath the skin of the ear that pay out over this time. You know, one of the things, we've got about a minute before we go to break, but it lends itself to me that these products are extremely safe when it comes to human consumption and residues. I mean, a 200 milligram dosage rate over 180 days in an 800-pound animal. Do you have some feel for that?
What I like is our FDA, our CVM, has put in place what I'll call multiple hurdles of safety. You mentioned the implant being placed under the skin in the middle third of the animal's ear. I always ask people, when's the last time they sat down to a nice juicy piece of ear? I mean, we even put the implant in a place that will never be used for human consumption.
So in the meat, very little residue, if any. And when we come back, we'll give you some comparative numbers. You're watching Doc Talk. We're talking about steroid implants, their safety, and how they work in the ruminant animal with Dr. Chris Reinhardt.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Jennifer Hawley recently received an Amstutz scholarship. She grew up on a family-owned dairy with registered Holsteins in northwestern Wisconsin. Her passion for the dairy business led her to the University of Wisconsin School of Veterinary Medicine, and her work there took her to Mexico, New Zealand, Turkey, Ecuador, and Indonesia to learn even more about international agriculture.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers asked for it, and Norbrook delivers. Introducing new Enroflox 100, the newest addition to your arsenal for treating bovine respiratory disease. Enroflox 100 is an FDA-approved, ready-to-use injectable antimicrobial solution to treat BRD associated with Mannheimia hemolytica, Pasteurella multocida, and Histophilus somni in beef and non-lactating dairy cattle. Administered SQ as a multiple-day therapy. Consult with your veterinarian today about Enroflox 100, the new choice. This segment is brought to you by Norbrook Laboratories, manufacturers of Enroflox 100, the newest addition to your arsenal for treating bovine and swine respiratory disease.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Chris Reinhardt from the Department of Animal Science and Industries here at Kansas State University. And we're talking about steroid implants. And, you know, when we talk about the safety, I keep going back to that publication Dan Loy put out from Iowa State, comparing the estrogenic activity of different feedstuffs or foodstuffs. And when you look at soy flour at over 350 million nanograms of estrogenic activity, or tofu over millions of nanograms of estrogenic activity in an 8-ounce serving, or you look at eggs and cabbage and peas and their estrogenic activity of 2,000 nanograms of estrogenic activity. Folks, when you're looking at an 8-ounce steak from an implanted steer, there are 3 nanograms of estrogenic activity in that steak. When you look at the estrogenic activity of a steak from a natural or organic steer that was not implanted with a steroid implant, the estrogenic activity within that 8-ounce steak is 2 nanograms of estrogenic activity. So the difference of 1. How small is a nanogram? A nanogram per kilogram is equivalent to a blade of grass on a football field. So when we talk about the safety and we talk about the opportunities that we have, you know, I think a lot of people are misled on the amount of estrogenic activity or steroid activity, and you really need to get to know the facts, because there's a lot less estrogenic activity in meat that's implanted with steroid, beef from cattle implanted with steroids. than what there is in eggs or milk or cabbage or peas or tofu or things of that nature, in magnitudes of thousands and millions.
And the other thing I like to add is that doesn't make those foods unhealthy.
No, they're very healthy. They're good for you.
Our bodies have the ability and the design to process those and use those and not be affected by those estrogenic activities whatsoever. And so all of this screaming over 1 nanogram when our body itself produces hundreds of millions every day gets me excited.
A pregnant woman produces 20 million nanograms of estrogen a day. A non-pregnant female produces 500,000 nanograms of estrogen a day. An adult male produces 130,000 nanograms of estrogen a day. It's something natural, and we're going to throw the baby out with the bathwater over that blade of grass on the football field. So anyway, well, let's talk just briefly. We've got about a minute. Just tell me the efficiencies that utilizing these products, because they also improve sustainability and decrease the inputs of natural resources to produce beef.
We have the opportunity to use implants almost from the birth of the calf. We have very low dose implants that match the size, the small size of a young calf. Through the suckling phase, we've got implants that match the growing phase, whether they're in the dry lot or on pasture. And we've got implants that match that bigger animal. Long story short, use of those implants reduces, I'll say, the carbon footprint, improves the production efficiency of that animal in its lifetime by 10 to 15%.
So 10 to 15% less feed is required to produce that animal of the same size relative to one that we don't utilize. And that's huge.
It's one of the few things we can do in production agriculture that delivers every time.
Hard to tell somebody in a developing nation why we wouldn't use these kind of products to improve efficiency and make more food.
True.
Thanks for watching Doc Talk. When we come back, we're going to talk a little bit more with Dr. Reinhardt about how these products work in your cattle.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Calves require adequate, high-quality colostrum immediately following birth to receive the immune and nutritional support needed to fight diseases and thrive. Next-generation Colostrix colostrum replacer and supplement are USDA licensed to aid in the treatment of failure of passive transfer and contain natural maternal bovine colostrum antibodies against E. coli K99. Ask your animal health supplier for Colostrix or visit agrilabs.com for details. Colostrix makes all systems go.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Chris Reinhardt here from Kansas State University, and we're having what I think is a great show because it's something I wanted to get on the show to explain to people and have this, get it on YouTube, get it on our archive, share it with your relatives, because the truth about the safety and the effectiveness of steroid implants really needs to get out there, because this is a technology we need to keep, and this is a technology we need to expand for beef production. But let's talk about how these products work. So I give a calf a steroid implant. We don't use this in pigs and chickens because they don't work in monogastrics. They work in sheep, goats, and cattle. And so tell me, once I give an injection, or give, not an injection, but I give a steroid implant underneath the ear to a calf, what's happening?
And that's where we can really lose our audience. It's very, very technical, and it turns on dozens, if not hundreds, of systems inside that animal. But what I like to relay that to is I was so excited when I learned all of those really complicated systems that are getting turned on by that tiny little pellet are the exact same systems that get turned on by using a bigger breed of bull.
Gotcha.
It's about growth and really turning on the systems that genetics for bigger size, greater efficiency turn on without that implant.
So basically, when you use a steroid implant in a calf before puberty, you're just shifting that mature body size. It's actually the opposite of what most people think is happening. Most people think that when you give a hormone, the onset of puberty comes quicker. Actually, when we use the steroid hormone, we're actually delaying puberty and shifting the mature body size or the frame size of those animals.
We all understand that young animal is extremely efficient, very lean growth, growing frame, growing muscle, and just what you said, Doc, by delaying, us middle-aged people would like to have some of our fat deposition delayed for a couple of years, and that's essentially what we're doing with that calf. We're putting them in a more immature phase of growth. You're exactly right.
So we shift the mature body size, and I liked how you said it during the break. You know, it's like it's equivalent to selecting a different bull for frame.
Yeah, if you're a Western rancher trying to use a smaller frame bull and to raise small heifers and smaller size cows, and yet you have steer offspring, using these implants essentially allows you to cheat the system, rewind the clock, and turn that frame 5 calf into a frame 6 or even a frame 7 calf.
By using the steroid implants. So when we say we're shifting the mature body size of these critters, we're taking these animals from a frame score 5 to a frame score 6 or 7 by the use of the implant. And if we didn't use the steroid implant, you would just leave them at a frame score 5.
And mark it at a much lower weight, and that's really what we measure efficiency by, is how many pounds we get to sell at the end.
Cool. Let's take a break. When we come back, we're going to wrap up with Dr. Reinhardt. We're going to talk a little bit more about how these steroid implants affect the body and growth rates of your calves. You're watching Doc Talk, and we're really glad.
The BQA Tip of the Day, sponsored by Behringer Engelheim Vet Medica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation. Today's BQA Tip of the Day isn't so much a tip, but it's a challenge. It's a challenge to you producers, stockmen, cattlemen, horsemen, whatever part of the beef industry you're involved in, to get BQA certified. It's extremely important for your education, for the success of our industry, and also for the health and well-being of these cattle that we care for every single day. Nobody cares for these cattle more than we do, but it's very important for us to get further educated in this process. It's very easy to do. All you have to do is go to bqa.org or even contact the Beef Cattle Institute at Kansas State University, and they'd be more than happy to help you through the process. It's easy, it's simple, let's get it done. Thanks.
It must be an inherited trait, because I have never wanted to do anything other than be in the cattle business. And it's interesting, as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it has been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it from an ATV, on horseback, or just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd. This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Chris Reinhardt, and we're at the Beef Cattle Institute at Kansas State University, where Dr. Reinhardt is in the Department of Animal Science, and he is our state feedlot extension specialist in the state of Kansas. And we talked about shifting that mature body size. And so when we use a steroid implant, let's just take a show steer or a commercial steer. We implant them, they're going to go from a frame score 5 to a frame score 7. So that shift in mature body size. When we get those animals to an endpoint, and the endpoint, as people know, is the amount of fat deposited over that 12th and 13th rib or the tail head, however you're going to judge it. These animals actually have more lean tissue deposition, more muscling, not necessarily because they're Arnold Schwarzenegger. You know, I mean, people think of that with steroid implants. That's not the reason. The reason is because we shifted that mature body size, and to get that taller animal to the same endpoint, we had to deposit more muscle to support that frame.
I really like that analogy of shifting the growth curve to the right, as it were, because the implants do the same thing as using a bigger bull. It's not like simply blowing them up like a muscle builder. Implants turn on everything, but so does using a bigger breed of bull. There's just more pounds there at the end.
So we just wind up with a larger calf, and the efficiency comes because we're getting increased pounds of gain on the same amount of feed as what we did with that smaller frame animal.
And that's really where we are today in the beef industry, is trying to find efficiencies in the margin. And implants, as I said, are the one thing we can count on time and time again of delivering that efficiency.
So steroid implants will increase lean muscle deposition. They have no effect on fat.
Correct.
And whether it's fat deposition across the loin or in the steak, people have that misconception that steroid implants decrease the quality grade because they decrease fat deposition. They actually just increase the muscling deposition around the same amount of fat.
Correct.
So what about tenderness in steroid implants?
That's the same story. Simply making the animal bigger and more efficient, as long as we take them to that same fat defined endpoint, whether that's external fat or marbling deposition, the tenderness is the same.
So we do have to worry about quality grade.
Correct.
So what are some of your strategies or recommendations for producers to when to really worry about quality grade and how to impact that, not impact that in a negative manner?
The simplest thing is to match the dosage of the implant to the animal and the nutrition provided.
Chris, thanks for being on the show today.
You're always welcome.
Folks, Dr. Chris Reinhardt, I don't know if we could do a much better job of getting this message out, but steroid implants are a safe technology that we need to be using, and we need to get the word out to consumers and to people. So if you want to know more about what we do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. You've been watching Doc Talk. I'm Dr. Dan Thompson with Dr. Chris Reinhardt, and we'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. Doc Talk was brought to you by Merck Animal Health, the science of healthier animals.